you know, when a bariatric patient starts their bariatric adventure, they're scared, most of them. And most of them are scared of, you know, heart failure or blowing their hips or knees out or can't breathe or worried about being able to spend time with their kids, grandkids, those kind of things. And so, you know, massive obesity is really it's a medical emergency. And so when they show up here, they're not really thinking about all they're thinking about is, I got to get this weight off because I'm going to die of diabetes, hypertension, heart disease, whatever. And then once they lose 120, 130, 150 pounds, what happens is they start looking at themselves in the mirror and they feel like a new person, and they look like a new person, but again, they've got a lot of excess skin that they've got to hide. They can't wear the clothes that they want to wear, and it's you know, it's kind of like putting a Cadillac body on a Ferrari frame. You know, you just got too much. There's too much there. And so when those patients come to me, they're wanting help getting rid of excess skin. Most common places are, you know, the pannus or the skin in the lower abdomen. A lot of people don't like the arms, the arm area. Face, fortunately, the face is not affected that much usually. A lot of times breasts are affected, butts, you know, rear ends, and thighs. Those are the biggest areas. And what we do is try to come up with plans for people to help, you know, address their biggest problem first and then in descending order. And, you know, some of these procedures are relatively big procedures, so we stage them and do them at different times. Of course, your weight has to be stable for a certain period of time before they can be done. But we try to cover all that in a consultation. Some insurances will pay for some of these things. A lot of times they don't, and so what we do is we try to work with you to figure out what costs are going to be and try to figure out that part of it as well.